Haemoptysis after cryoballoon ablation. As you may notice over here, I do not have anything to disclose. We all over here will agree that cryoballoon in recent times has emerged as a popular, safe, effective alternative to the existing energy sources for atrial fibrillation ablation for not only paroxysmal but also persistent types as well. So what has been happening with passage of time, with wider popularity, increasing usage, and passage of time, we are becoming more and more aware of the side effects of cryoballoon ablation, which includes not only the gastroparesis, the esophageal lesions, but also the phrenic nerve paralysis and occasional fatal lesions as the atrioesophageal fistula as well, which does tend to happen due to the unwanted collateral damage to the neighboring tissues wherever the cryoablation is being done. So this is what made us to go through those established databases and search using the keywords, and we could see a good number of studies in which we try to further use screening. We also try to use strict parameters of inclusion and exclusion criteria as well, trying to eliminate the duplicate studies. After that, we were still able to get a good number of studies which we used for our systemic review and meta-analysis. As we may see over here, we had a pretty good number of nearly 3,537 patients from 21 studies who had underwent cryoballoon ablation with still a good amount of follow-up, out of which we did notice 113 patients did have haemoptysis, which was 3.2% of those patients. We could further classify the haemoptysis on various parameters, including the one according to the cryoballoon size which was used. So we noticed majority of them in 12 studies, which included more than 2,500 patients, had undergone ablation with the bigger cryoballoon of 28 mm. On the other side, 23 mm cryoballoon was used in 5 studies, including 672 patients. Further, according to the onset as well, we were able to classify them into early onset, which was there in the first week, and the late onset, which was there after the first week. Around 11 studies, which included 51 patients, had an early onset, and in 10 studies, for 62 patients, the onset of haemoptysis was late. And then on the basis of severity, we were able to classify them into 3 groups, having mild symptoms, mild to moderate, and the severe. So what we did notice that majority of such patients did have only mild symptoms, and nearly 20% of those patients did have mild to moderate symptoms, and in a few of them did have severe symptoms as well. Coming to the mechanism, there are multiple mechanisms which has been postulated. In fact, cryoballoon or the cryoablation itself does cause vascular injury through multiple parameters or factors, including the ice formation within the vasculature, and the ice during expansion causes the formation of tears, clefts, cleavages, and the stasis post-perfusion as well. And the interruption of the vascular integrity is the reason for intramyocardial hemorrhage, as well as for haemoptysis, which is associated with cryo injury to tissue. In fact, the transient interruption of vascular integrity, perhaps within the pulmonary capillary system due to the cryo injury, has been postulated as one of the key reasons for haemoptysis. Very low freezing temperature, which is always associated with good isolation, is the etiology also for hemorrhagic infarction and the clinical onset of symptoms like haemoptysis. Another postulate is they are like the complete isolation with a very low freezing temperature does cause cryoinjury to the adjacent tissues and also to the vasculature. And a lot of times, if there is a direct trauma to the vasculature, let it be through the guide wire or improper positioning of the balloon as well, that itself may very well lead to the early onset. As we can see clearly in this figure, that there is a deeper positioning of the guide wire in the right inferior pulmonary vein using the intra-procedural fluoroscopy. As we all are aware that right inferior pulmonary vein electrical isolation can be a big bottleneck. A lot of tips and tricks has also been postulated for that, but problems are there for that. So then a lot of times we tend to use the bronchoscopy, the x-rays, and the coagulation markers for seeing those patients. But let's not forget about the HRCT, high resolution CT imaging has also a very good correlation for these clinical features as well. So in these patients, we tend to observe the ground glass opacification, which is there. We also further observed that they tend to have a temporal resolution as well. So that's why when these imaging studies are being ordered, they tend to have a good effect on the diagnosis and also the prognosis of such patients. The onset of haemoptysis was at the day 29 plus minus 56.5 days after cryoablation, with a median of around 7 days and a range of 2 hours going up to 210 days. And considering the median of 7 days, we had classified it into early onset and the late onset. In fact, a total of 11 studies did reveal the haemoptysis occurred in 51 patients in the first week of procedure. 9 studies with 58 patients developed late haemoptysis, which was after first week of procedure. And a total of 12 studies revealed mild haemoptysis in 83 patients. And as we can see in the figure, a total of 6 studies demonstrated mild to moderate haemoptysis in 22 patients. And 4 studies did demonstrate severe haemoptysis, although in a very low number of patients. So to conclude, maximum incidence of haemoptysis is mostly seen just within few days after the procedure and is independent of the other complications like the phrenic nerve paralysis, the gastroparesis as well. And in fact, the dexterity of the pulmonary vein location does not influence the incidence, and it's the duty of not just the physician but also all the members of the healthcare professional team who are involved in the procedure and taking care of the patient that a high degree of suspicion is maintained to avoid any misleading diagnostic procedure and to allow proper and prompt management, which the patient deserves very well. Thank you so much for your kind attention.